You are listening to Sean Harrison on Amp Live Talk Radio, a place for amputees and those dealing with limb loss. The views expressed on the show by the host, co-hosts, and guests are their own. Always seek medical advice from a licensed medical professional.
Well, hello everyone. You caught me right at the end of our little intro there. We were getting some things ready on all of our different platforms. So you guys kind of caught the tail end of that. So again, we do have some I'm working on some new things before we get into the new year of 2020, because one of the things that's going to happen, which a lot of you are probably seeing right now, is that I'm playing with earlier show times. So sorry about that, guys. I had to, people on YouTube can see me. And for those of you out there in podcast land, you cannot actually see what I'm doing. So, but I am playing with some different show times. I want to try and bring the show to be a little bit earlier. So for those of you that are out there, know that I'm not lost. I know it's not 6 o'clock. I totally know it's not 6 o'clock. But what I'm doing is I'm playing with some different show times. And what I'm doing right now is I'm sharing all of our stuff to all of our different Facebook platforms. So I'm trying to make sure everybody knows where we're at and what I'm up to, because I'm always doing something where nobody can really keep up with what I'm doing most of the time. But most of the time, you guys kind of know what I'm out there doing, and I'm trying to keep in motion. So if you hear me clicking and typing on keys, I'm working in all these different browsers. I got all these things up in front of me, and of course, Facebook always wants to send you a billion different messages to log into different places, and a lot of times you can't get these things logged in until you actually get on there and get logged in. So I'm over here playing around on Facebook, and I'm looking at messages because everybody blows me up right when I try to get on the show. You ever had that problem where you're trying to do something and then everyone wants to give you a call right about that time to where you're trying to get on and do something, and then everybody and their mother wants to send you something. So please be patient with me as I'm kind of taking care of some of these final little things, little details, as we're taking care of things and trying to get ourselves all situated here. Well, I want to say tonight's show, for those of you that have followed me, you know that I've talked about a lot of different topics. So as I go back through some of my shows and see how we can do some things better, I see some shows and I think to myself, I might want to retouch on that show and do that show again, just to make sure that we are really making sure you're getting the best information out there possible, because that's one of the things that I want to make sure that I'm doing, is always giving you the best information. I'm always trying to give you up-to-date, real information, and we're always trying to make sure we cover each topic very well, because as most of you will know, all of these topics have multiple ways to be covered, talked about, explained. It's just, when you start looking at the topics of amputation, dealing with amputations, amputees, everything that we deal with, there are so many different topics that can be touched on when we look at that one single thing of how we deal with amputation and some topics that surround amputation. So I try to make sure that I am doing everything I can in my power to make sure you are getting the best and most reliable information. That's why I do what I do. Now, for those of you on YouTube, I'm not looking at my camera. I'm over here doing a multitude of things in my other screen and trying to get other things to pop up. Hence, that's why I'm kind of killing some time with you. I want to cover some things because there are going to be some new changes coming up, and I want to make sure we are all on the same page when it comes time to doing this, because That's going to be very, very important when we go to 20, as we start to do these things and we start to get ourselves situated with getting ourselves all moved in on the new platform and doing all the different things that I would like to do with this show. So, um, I want you guys to be very patient with me, but I am looking at what's best, not only for myself, but for you guys also, because um, I am I'm finding myself to be very, very busy with all the stuff that I'm doing between everything we do with the magazine. And, just I'm curious how many of you actually know about the magazine, Amp Nation magazine, and how many of you actually follow us over there. I'm going to move away from my mic because I need to look at something. I'm at my desk and I am looking up things here because we're trying to get some things done here. So I want to make sure all of you are actually following us over on Amp Life and Amp Nation, because those are two of our platforms to where we're trying to do some really cool things, giving amputees a lot of good information, providing a lot of cool things for you guys, and trying to make sure we're sorry about that. We're putting some good stuff together. So I really hope that all of you are able to find us on all these different platforms. There we go, and show us a little love. So on Amp Life Talk Radio itself, what I'm trying to do is I'm trying to get us to the 1K mark before 220. So if some of you would be so gracious to, to go over there and to like our page and to show us a little love, man. Help me get to that 1K mark over on our Amp Life Talk Radio page. And if you are daring and you love us a lot, um, I would love to see some of you help us out over on Amp Nation magazine, because those are the two platforms I do the majority of my stuff, and I would like to see you guys give me a little love there, help push us to the top, man, push us up there. Okay, I think we've got everybody notified. Everybody should know where we're at and what we're doing right now, because a lot of people aren't used to me starting my shows early. So I tried to give a little heads up that I am live over on YouTube. Live on YouTube. That's what I'm letting people know right now. And I don't want anybody to miss the show. So I'm going to tell them also join me. Then we're going to get into the show. As most of you saw, tonight's show deals with skincare. And when you think about that, what are we going to be talking about? What are we talking about as far as skincare? How are we going to be giving you some good information as it relates to skincare, taking care of your skin? And what skin are we talking about? That's going to be something that I hope all of you are ready to hear. Sit back, relax, join me as I take you through this wonderful journey on skincare. So, those of you that are used to the show, those of you that are new to the show is called Amp Life Talk Radio, a podcast for amputees and those affected by limb loss. I am your host, Sean Harrison. I look forward to being your guide and helping you along this journey. Whether you're new or you're old as an amputee, I try to provide some good information to you so that you can figure this out, this whole new life that you're now in, and all the things that you're doing. For those of you that are new to the show, as you see behind me, uh, I don't like calling myself an athlete. I'm a guy that likes doing stuff. I guess I'll just say that. And my poison is Spartan racing, obstacle course racing. As an amputee, yes, I am an amputee and I do obstacle course racing. So those are some of the medals, some of the click clack that I've put together over years. There's a bigger one up. There's a plaque my team recently took Para Spartan Championships in Laughlin in November. 4-man team. All of us are missing limbs. Team straight out of legs. I'm your host, man. I'm a real guy, a real amputee, trying to put something out here that's going to help other amputees and hopefully change your life and help you be better at whatever it is that you want to do with your life as an amputee. That is my goal. That is my number one goal, is to help other amputees be better at being an amputee, getting back to life. So, with that being said, you know a little bit about me. Now, what I would like to do is help you. Before I do that, I'm going to get me some coffee, man, because it's been a long day. And yes, for those of you that are looking, that's the new Amp Life. Well, they're not really new, they're older, but these are my coffee cups. I owe some of you coffee cups, and I think the reason I've been holding out is because I'm looking at designing a new cup. So if you can bear with me, I'm going to design a new cup. I am actually looking at my heat press. We have a Cricut cutter. We're going to be making t-shirts, and I'm going to be doing giveaways in 220. So you guys can win some really cool stuff. So I hate to ramble on, but man, there's so much stuff that I'm doing, and I want to kind of let all you guys know what's going on. So if you tune in over here, just know that it's with love. It's with love that I do this. So pardon the sipping, but coffee, because I need to wake up. We got some stuff to get through here. All right. Tonight, skincare. How do we take care of our skin? Well, boys and girls, here's one of the things I wanted to cover with you when we're talking about skin. And as we think about skin, I'm adjusting my screen just in case somebody pops on. If you pop on and start sending me a message over here in YouTube land in the studio, I'm sorry if I don't see you, because I have a lot of notes I need to read through. So bear with me. So tonight's episode, season 3, episode 36, as we talk about skincare. Skincare, why is that important? Well, proper skincare for your limb is very vital, very crucial. It's very essential for you to have good health and mobility. So in order for you to do that, we need to make sure we're taking care of our skin. Prosthetic sockets trap sweat and all different types of things inside that liner that you put on, and they prevent air from circulating around your residual limb. That's very important, which can create a virtual paradise for all this bacteria and fungi that tends to live in those environments. Bacterial and fungi infections can lead to skin irritation, abrasions, and eventually skin breakdown, which is what we don't want. We do not want to have any type of skin breakdown, especially if you are a diabetic amputee. Left unchecked, this could lead to an infection and ulcerations, leaving you unable to ambulate, leaving you to be sitting around in a wheelchair or on crutches. It's going to make you unable to be able to use your prosthetic device. That's what we don't want. That's what we want to prevent tonight with this talk about skincare. I want you to be able to protect your limb. Okay. Skin that comes into contact with the prosthesis, your prosthetic device, your socket, must be cared for meticulously. We need to develop a system. I tell everybody that you had some habits before you lost your leg. We need to develop some new habits now that we have a residual limb. So we need to be very meticulous about preventing skin damage and breakdown, irritation, all those things, infection. Skin breakdown is the process of skin being worn away. And you can only imagine how that can really be applied to your leg being inside of a socket under all these forces and pressures. The end result is going to be sores. We don't want to get sores. Pain is the first indication. That is the first thing we need to realize, that if there's something going on inside of your socket with your limb, pain is probably going to be the first red flag that you need to look for. Every amputee or every patient should remove their device immediately, okay, and check out their limb. Always invest in a good hand mirror to look really deep down underneath the residual limb to see what's going on. You need to inspect the residual limb, check the skin integrity. When you find that you are experiencing any type of unpleasant feeling or sensation or pain, this is your first red flag that is a signal to you something might be happening and going on down there that you don't want to be happening and going on. Usually, the disorders that put people at risk uh, of amputation, such as blood vessels disorders, diabetes, all these different things, circulation issues, also increase your risk of skin breakdown and infection after the amputation. So if you had one of these that caused your amputation, you want to be very careful because these things can also come back to get you once you have a prosthetic device. So we need to take some precaution in doing some things that will help protect us. Some of these disorders, such as diabetes, which we all know is a very uh, important disorder that we need to keep up with, and others such as neurological disorders, where basically your ability to feel pain in your limb is affected or impaired. That ability can definitely be detrimental to our health if we're not keeping up with what's going on by visually and physically inspecting our limb after every use. And I even encourage you to inspect before and after each use if you're in a prosthetic device. That's going to be just a safe way to know when something happens and what's going on. People with such disorders may not feel these discomforts or pains that we're talking about that are red flags. So when skin starts to break down, you don't really know if you're not doing our physical and visual inspections. So your infection is going to be not seen, and something is going to move very quickly on you if you're not doing these. Um, I highly recommend these people. You should remove the prosthetic device several times a day to check the skin for redness and other signs of breakdown or infection. Um, I recommend other people who everyone should check these signs at least once daily, if not multiple times. But those of you that are dealing with some of the disorders that we talked about, try and do it more than once just so that you can catch something and stay ahead of it. That's the whole reason of doing it multiple times throughout the day. Skin problems can be very serious and should be elevated and treated as such and as necessary uh, by your healthcare provider, your health team, your doctor, your wound nurse, whoever it is that you're working with. Consult with them if you find something going on or something wrong. And that it even includes your prosthetist, your practitioner who makes the prosthetic device. Sometimes just by paying him a visit, he could alleviate pressure in the socket that will help with some of the pain that you're experiencing. Always, always, always consult with the experts. Practitioners are a good resource, and these experts who design and fit the prosthetic devices can actually give you some valuable information to carry forward to your doctor if they do discover something and see something that is wrong from a medical standpoint. So there's two standpoints. There's the prosthetic standpoint, the medical standpoint. Prosthetic wise, if there's something wrong with the device that's doing it, then it's your practitioner. Medically, if it's a condition dealing with your health, you need to see your medical team, your doctor, your podiatrist, people like that. Okay, wound nurses. Um, I want to make sure we talk about skin breakdown a little bit, and keep in mind, I try to. These are like power talks now because my shows typically were long, an hour. Well, studies show that most people don't have that much time to tune into a show. So we try to keep them to 15 to 30 minutes. Pop. That's it. This is a power talk, man. So we in, out, we smash through the information. If you want to, you can always go back and relook at the show. It's not like you can't review the information that we're talking about. So I always have to just smash through these. The only time we're going to be doing long shows or is if we have a special guest on. Then we take time to give the guests time to talk about what they're talking about. So know that those are some of the new changes coming into 20. Skin breakdown. Skin breakdown occurs at a site of pressure. Let me say that again. Skin breakdown occurs at a site of pressure where um, lateral shear forces are applied to the skin, particularly when moisture is present. Sweating. We all talk about that. Common pressure and shear injury locations include most of your bony prominences, especially if you're a BK around your knee. You're going to see a lot of stuff happen there. And then at the distal end, at the very front of the tibia bone. So the tibial bone, the main bone that they amputate when they cut off your foot. Those are hot spots. So always check those, always look at those, and always um, be keeping an eye on those because those are going to help keep you safe. Yes, another sip of this wonderful coffee. So, and like I said, there's some of you that see me on YouTube. There's some of you that just hear me on the podcast. So you're missing all this this glory. uh, the first sign of skin breakdown, we need to make sure we get on the phone and start calling and checking with people, whether it be followed by pain, swelling, blistering, and ulcers. We want to make sure we're proactive in our care. Get on the phone, talk to people. If you continue to wear the prosthetic device causing this pain, more serious skin damage can lead to skin infection. Let me say that again, because I know a lot of people tend to continue to wear their prosthetic device after something has started to happen. If you continue to wear the prosthetic device after something has been discovered, some type of skin breakdown, rash, some type of uh, ulcer, anything, swelling, blisters, anything, you're going to make that situation worse. So be advised, get in and see someone quickly and get off that leg. Although it is not possible to prevent any type of skin breakdown, there's always going to be some type of skin breakdown happening just because of the sheer forces that are being put on your residual limb. We just need to make sure that we're checking and staying up to speed with what's going on with that residual limb. There's a lot of different things here in my show notes that I'm looking at. Just quickly, we know most of these, and I don't want to read through every last one of them, but come on, guys. Residual limb hygiene. We need to make sure we're washing our leg and doing the right thing to keep it clean. Maintaining your interface, dealing with your socket, getting in to see your practitioner on a daily basis. I know some people that don't go see their practitioner for almost a year, 8-9 months. You can't do that. Put yourself on a schedule of 3, 6, and 9. If you can do that, remember those numbers: 3, 6, 9. See your practitioner every 3 months, 6 months, and 9 months. You're going to avoid a lot of trouble in your leg. If you don't, you're probably going to experience some trouble. Always remember, I'm always going to encourage you to eat healthy and take care of yourself. Drinking water. Now, that's different for everybody, especially if you're a diabetic patient. I'm not going to be sitting here telling you to drink a bunch of water, not even this wonderful coffee that I'm about to absorb here. So, for patients with diabetes, monitor and control your blood sugar. That is going to be very important for you. Patients with lower limb prosthetics, ensure that the prosthesis is aligned optimally. So 369, remember that 369. It's just like your vehicle. You're going in to get your oil change. Same thing with your prosthetic device. 369. Get in and see your practitioner every 3 months, every 6 months, every 9 months. Put it down, write it down, put it on the fridge, man. Skin infection. So we want to avoid skin infections if at all possible. But if we don't take care of our skin, this is where we're going to end up at, with some type of skin infection. And in normal, healthy skin, bacteria and fungi are kept in balance by dry um, uh, conditions, we'll say. However, the residual limb, because it is contained within a interface of, let's say, the liner, the socket, There's no light. There's no air circulating through it. It's just in a gel layer, and then you're inside of a carbon fiber socket. This is like it's an incubator, man. It's a prime condition for that creates warm, moist environment that encourages the growth of bacteria and fungi, and it is easy to develop an infection. So damp skin is like a breeding ground for infection, and that damp skin is vulnerable to breakdown, giving bacteria an easy in between cracks that might be happening, and especially if you scratch the limb. So we want to make sure we're trying to stay ahead of this game of skin infections. Now, some signs of infection include tenderness, skin being very warm to the touch, um, different things like that. Red spots that are not dissipating or going away after you pull off your socket. They're prolonged, they're staying there. You have a hot spot. We need to get in and see our practitioner to make some adjustments there. Poor hygiene will definitely lead to skin infection. Poor hygiene. We need to make sure we are washing our leg. And guys, there's so much out there about bleach and all these other things. Why would you want to wash your leg with bleach or your liner with bleach when you don't do that with any other part of your body? Think about it. No bleach, man. Don't use all these harsh chemicals on your liner, things that are intimate touching your skin. I know there's all these different schools of thoughts, but I suggest way on the side of caution. We don't scrub our skin with bleach. Nobody does that. So why would we do that to our residual limb? Think about it for a second. Don't use bleach or harsh chemicals to clean anything that's going to come in contact with your skin in those types of environments, enclosed, warm, sweaty conditions. Okay. Best advice I can give you, really. Um, as we kind of finish off this talk, I want to say we have to make sure we're treating the bacterial infections or any type of infection that we get. We want to make sure we treat those fast and immediately. And if we can, catch them ahead of time. The last thing we want to do is end up with some type of revision or some type of debridement, ending up on oral antibiotics or back in a skilled nursing facility, or worse yet, back into the OR and the hospital. So guys, to avoid this stuff, please check your skin. Just something so simple. Check your skin, stay on top of your skin, stay on top of your residual limb, look at it, follow it, just be smart about it. Just understand it. It needs to be looked at daily, not, every so many days or every so many weeks. Your liners need to be cleaned daily after each use. Get in there and clean those things. So if you have any questions, everyone, I want you to know you can always reach out to me at Sean, SEAN, at Amp Life Talk Radio. And again, reach over to me at ampnationmagazine.com. Both are on Facebook, Amp Nation Magazine and Amp Life Talk Radio. I would love to hear from some of you, and I'm going to be setting that up in 220. We're going to have certain shows where they're call-in shows only, and we're going to be taking calls from all the listeners. So I'm going to be setting you guys up for that, to where we're going to turn the mic over to you. And I want to make sure all of you get a chance to call in, talk, share your story, whatever you want to talk about. Whatever you want to talk about is what I'm going to turn. I'm going to turn the show over to the inmates, man. So you guys, I love all you guys. I appreciate all the support and effort that everybody puts into subscribing, liking the show, tuning in. I know it's a little different. People on Facebook are like wondering, where the heck are you? I'm going to try and make sure everybody knows where to tune in at, so we can get all of you over here on YouTube and blow this channel up. Okay. Again, I want to say thanks to everybody for following me, for your support. And I look forward to doing great things with you in this new year that we've got coming up. Amp Life Talk Radio 220. We're going to do this. Again, my name is Sean Harrison. I'm your host here at Amp Life Talk Radio.
You are listening to Sean Harrison on Amp Live Talk Radio, a place for amputees and those dealing with limb loss. The views expressed on the show by the host, co-hosts, and guests are their own. Always seek medical advice from a licensed medical professional.